Okay, this video is still talking about socialized medicine as I was talking about in my last video. And in my last video, I stated that I had three major criticisms of socialized medicine. It encourages people to be stupider about their healthcare. It is based entirely on involuntary action, which is a violation of what most people would call liberty. And the third reason is that it adds to the medical shortage in the long term by driving out doctors and medical practitioners from the market because they're not reimbursing them, and it's going to add to the shortage. Okay, those are the main criticisms. And the other criticism, of course, is that, as I pointed out, is that the government is not just, inventing a way to pay for this health care. Okay, when those funds that are drawn into the single payer system are being used up for the year, the government has to do things in order to make budget. In the National Health Service, I know it's an English law that every individual sect of the National Health Service cannot run a deficit. They have to at least break even, and they never make money, but they have to at least break even. So the question is, again, as was pointed out in the last video, if most countries have less doctors statistically than America, how the hell is it that they're breaking even in the socialized system where how is it that they're breaking even when they don't have more doctors to provide the services? Well, like I said, they're doing specific things. They're not reimbursing doctors a lot, which is a way to save money. Obviously, we do it here in America in Medicare, and that's a reason why doctors get upset and hospitals have to charge more for other surgeries to people with insurance to make up for what the government isn't paying the doctors. But also, it's based on the fact that the government in socialized systems will indeed restrict surgery for certain people. If the surgery is expensive and you're getting close to that budget crunch time, we wouldn't call it, the Canadians will never call it canceling, but they might say for the surgeries that aren't necessary, we're just going to make you wait. Well, how long can that wait be? That wait can be 6 months. That wait can be 12 months. That wait can be 18 months. And basically the government is trying to deny the surgery at least through the next year, so it's on next year's budget. I mean, we're doing this in our current healthcare bill in the Senate. They split the bill up into, I think it was 3 fucking pieces to make it deficit neutral. So the main healthcare bill won't add any money to the deficit. It's the other 2 bills that have all the money that's going to run up our already $1.4 trillion deficit. So they're basically fudging the numbers to try to make it look like it's not costing money. Okay, now this video is also going to anticipate certain criticisms of this video, because I know, if Canadians watch this, they're going to come back and bitch and say I don't know anything, and I know certain criticisms they're going to say. They're going to say that the first one is going to be, I've never waited for healthcare. I've gotten in next day. I've never known anyone who's gotten denied healthcare. And you're an idiot for saying that they make you wait for surgery or there's a long line or something like that. Okay. I was arguing with someone in another video about this, and this is basically the logic they're trying to use. And I used it as a response, and the person didn't get it or didn't think it was the same thing. I personally have never known anyone who has gone to the moon. I don't know an astronaut. I don't know anyone in my family who's met an astronaut. I don't know any of my friends that's met an astronaut. For all I know, the astronauts that went to the moon could have been made up. Okay, so if I'm following this logic, I don't know if we've gone to the moon or not. I've never met anyone who's gone to the fucking moon. Okay, this is the logic that they're using. They're saying, well, I've never known anyone who's been denied health care. I've never known anyone who's had to wait. So no one must be denied health care. Everyone gets it, There's no problem, and you Americans are stupid because I've never known anyone denied. I can come back and say, not only have I not met anyone who's ever been to the moon, I've never been denied insurance by my HMO. My family has never been denied insurance by our HMO. I've never known anyone who's been denied insurance by our HMO. Apparently, it's about 3 to 4% of claims every year, but I've never met anyone who's had it happen. So again, based on that logic or lack thereof, the HMO system is fine and we don't need healthcare reform. But what I'm trying to point out here is that the fact that you've never met anyone personally that's never seen the faults of the Canadian healthcare system doesn't mean it's grand. Okay? The post office has never lost my mail, but I know a ton of fucking people that can never send mail through the post office because they always end up losing it. Okay, so this is a logical fallacy that a Canadian will come back and say that I'm an idiot because, no one gets denied healthcare. Despite the fact that the basic logic tells us, and based on how Canada spends their money on healthcare, that they have to lose money somewhere in order to break even. The other thing that Canadians will point out, and this I went up and looked up this report, is that it used to be criticism that doctors would run from Canada down to America. And Canadians will point out that a report that came out, I think, 3 years ago, will point to the fact that Canadians were getting doctors back They were gaining doctors back into Canada more than they were losing doctors between the period of 2004 and 2006. It was put out by an organization funded by the Canadian government. I wonder how biased that can be, but that stated that the Canadian healthcare system wasn't losing doctors. Okay, there are two funny things I thought about when I was reading this report that not too many people will talk about. Number one, if you read the fine print, that report does not count people who went to a Canadian medical school but never practiced medicine in Canada. Those don't count as Canadian doctors. For instance, if you go to some medical school in Canada and then immediately come to America and never practice medicine, you're not a Canadian doctor. I think that's hysterical. If a American graduated from Harvard Medical School and went to South Africa to practice, charitable medicine in some African country, would we consider him, say, a South African doctor or a Congolese doctor? No, I think we would call him an American doctor living in the Congo or American doctor living in South Africa. Canadians purposely don't count that statistic in order that the numbers stay lower. And I can't find that statistic because that particular report won't put it out. The other funny thing about it is that the report ends at 2006. It doesn't record any data for 2007, 2008. I've Googled it. I can't find any information, which makes me think that it could be leaning back towards Canada losing more doctors, but they simply don't want to report it. Again, I can't find it. But the most important statistic Canadians will come back to me and will criticize this video for is that they can Google and find out how many people die in the American healthcare system. And it's something, I think it's like 40,000, somewhere around there. And they'll say this is the failure of your system because no one dies in Canada. You know what? Or no one dies in England or whatever I said. I tried my damnedest. I looked up both the statistics for how many people die in Canadian healthcare and how many people die in English healthcare. Guess what? I can't find those statistics anywhere on the internet. I looked for hours trying to find them, going through pages and pages of Google and Bing, and I can't find them. Okay? So that tells me two things. One, no one has ever died ever in the Canadian healthcare system or the English healthcare system. Think about that and tell me if you would believe that. Okay, so number one, no one has ever died, ever, in the history of either system. Or two, the governments aren't releasing those statistics. Okay, and logic would tell me that if the Canadian and the British systems were so damn great, that they would be jumping to release those statistics, that people weren't dying because they weren't getting surgery, that people weren't dying while they were waiting for surgery or whatever. They would be jumping to release those statistics to show us Americans how stupid we are. I can't find those statistics. I can't. I've looked for them and I can't find them. So if anyone, feel free to point them out in the comments on this video if you would like to show them to me. I certainly can't find them. All I can find is the American statistics, but again, that makes me think that the Canadian government is not releasing those statistics and the English government are not releasing those stats. And so it makes me a little bit critical of trying to say that the Canadian system is better when that would be a key factor in determining that. And then the other stat that they will throw out though is that Canadians live 3 years longer, I think, than Americans. And again, okay, great, that must be the result of healthcare. It's not the result of more Americans being more prone to, say, drive drunk and get killed, for Americans to get shot in a gang fight, the fact that we Americans tend to be more obese than Canadians, any other number of factors that could influence. But yeah, that must be entirely based on your healthcare. So these are just some of the criticisms that I'm anticipating from Canadians who would say that me criticizing their system or me criticizing the English system is a bunch of bullshit.